First, so that she can go home because she's been waiting. I'd like to introduce. I don't know if you want to. You can speak right from there. But this is Kayla Donahue. She is a full-time opioid data analyst. She is under the auspices of the Chittenden County Opioid Alliance, but she works here in the Burlington Police Department. And as far as her work priorities, it's sort of like half and half between the overall needs of the Alliance, of which we're a part, and then the needs of the Burlington Police Department. So when we talk about having a data-driven approach to the opioid crisis, you're looking at literally the face of it. So, and Ebony, do you want me to reach out to you in a bit, just to? You want me to reach out to you about this by way of follow-up? I'm sorry.
Oh, sure. That'd be great.
Yeah, thank you.
That would be great.
Okay.
Thanks for coming.
Okay, thank you.
Just before Ebony left. So go ahead, take it away, Kayla.
So I guess I'm just really excited to be here and working on this project and learning more about the opioid crisis. Happy to be working with the police department and exploring some police data. It can be really useful, I think, in combating some of this public health work and public safety work that we're doing together. And here's a resource if people have questions or want to look at different data outcomes. Happy to do my best and be here for the community.
Thanks. Yeah, I think one of the things we're seeing is that when we started this initiative over 2 years ago, I was just saying this to Kayla today, we had no database. I mean, we had we knew at the end of the year, we knew how many people had died. That was pretty much the extent of our understanding. And I know the Department of Health had a repository of data that the average layperson didn't know where to find, and police departments didn't know how to make sense of. But now I think with Sam, the prior analyst, we got a very, very solid foundation. And now Kayla comes in. Sam had more general quantitative training. Kayla has specific training in epidemiology and biostatistics. So we're trying to always, with each iteration, bring it to the next level. So that's where we're at. And I just wanted you to meet our new employee. So
Welcome aboard.
hey, go ahead.
Thank you.
What kind of data are you, specific types of data are you going to be?
Take it away, Kayla.
All right, so I think historically we've been looking at a lot of kind of trends over time. So we've been looking at crime rates like related to opioid use. So some of those include like increased retail theft, burglary, prostitution, things along those lines. So we've been looking at those and comparing them to opioid-related crimes like drug possession or overdose. We have data from the hospital. They share the emergency department encounters. So we have those numbers, and then we also have their disposition, so where they're going when they leave the emergency department. We have some data from the hubs, or the Chittenden County hub rather, and the spokes in the area. So we have data on how many people are requesting services, how long it's taking them to get services, things like that. And then we have the siren data that the health department shares with us, which is from the emergency medical responders. So it's the EMS database. So it's how many overdoses and naloxone distributions were given by EMS across the state, and then for Chittenden County. So we're working on getting some more, and then of course the police data, which, I mentioned that, sorry. This has been a long day. So, working on kind of coordinating all the data that we have access to, seeing if there's any gaps and new data that we need, and then hopefully doing some more kind of studies. So we have like our Substat group that meets. Are you familiar with all of that? Perfect. So kind of seeing if we can delve more into that and try to predict who's going to end up in the Substat group before they're there. Try to be a little more proactive about who we're reaching out to. Maybe even following those individuals and back tracing to see where good intervention points could have been. And trying to do that for the new generations coming into this. So a lot of projects. Talked about even looking at how this is impacting first responders and police. So how showing up at an overdose scene is going to influence the individual. Looking at some of the clinical data with the clinician here for the first responders. Things along those lines are some initial projects we talked about, but I'm sure, just jumping into it, so there'll be more to come.
Thank you.